Health Minister Dr. Christopher Tufton is ratcheting up his healthy lifestyle drive with a new measure. Dr. Tufton wants to control the messages seen by patients in the nation's public hospitals. More in this report.
I tell people everywhere I go, I don't want to see any more Indian soap opera on the TVs in the hospital.
So it's official. The only soaps you will see on hospital TVs are those about hygiene. But why is Dr. Christopher Tufton changing the channel on TVs in the waiting areas of public medical facilities? Well, with nearly 2 million visits to health centers and over 1.2 million visits to hospitals last year, the health minister says he is trying to convert the masses to a healthier lifestyle.
We believe that we must create messages of encouragement to those who wait. So while they wait, they can inform themselves. And so what you will see are electronic transmission of messages, pictorial messages about health and wellness. Because if we convert 5 people while they're waiting, why it is important to cut back on the salts and the sugars and the fats, then frankly speaking, we'll be doing an additional service in our own interest and the interest of the country.
The health minister was speaking at the Black River Hospital in St. Elizabeth, where he launched the Compassionate Care program on Thursday. Under this initiative, staff members have committed to improving customer service, meaning they will be nicer to patients. He said this was the area patients think public health workers needed to improve most. In fact, on the clinical care side of things, Jamaican doctors and nurses are world-class. The health minister borrowed from the 2017 statistics to show how many lives they saved.
I was looking at the numbers. I'm a data person, right? So I was looking at the inpatient care and looked at the stats of those who returned from whence they came, having stayed in a hospital, and those who were dispatched to an alternative place, right? Those who never made it. And the stats were just under 5%, 4.5% of the 185,000 actually were dispatched to the morgue as opposed to back to their loved ones.
It was also stressed that patients and visitors to hospitals must be polite to health workers because their commitment to compassionate care is not an invitation for abuse. Andrew Laidley, TVJ News.